Welcome back. This is Sunday Breakfast with myself, Jude Duncan, and Enosa for just gone by our guest artist for the day, TM Music, treating us to some, soothing music, gospel music, and also some inspirational music, ending the note with his latest single that's out. He calls it Freedom. But for now, we shift focus to some health issues because your favorite doctor, our favorite doctor, everyone's favorite doctor, Dr. Kalsum Adams is in studio. Doc, welcome to Sunday Breakfast.
Thank you, Jude.
After a long hiatus.
You abandoned us during the Christmas.
Yeah, you were enjoying the Christmas holidays
so
and the New Year. And you didn't bring us anything.
Oh, that is coming.
It's coming.
Yeah.
Hey.
Bigger.
Yes, a house of records. So we'll be waiting. Doc, always a pleasure to have you in studio.
Thank you.
We understand it's Cervical Cancer Awareness Month.
Yeah.
Wow, is it like all the big cancers have awareness months that we don't know of?
Well, in order to raise awareness, increase the knowledge of the public, WHO usually, it's not usually a whole month program, but there are specific dates that's
within the month.
Yes, within the month or even within the year for specific awareness creation for different health conditions.
Okay.
But for cervical cancer and then breast cancer, we have a whole month education just to emphasize, even prostate and some other cancers. You have a whole month just to raise awareness and then let the public know.
Wow. A whole month is a lot. Is it because it's probably has the highest rate of incidence or prevalence?
Not necessarily. I would say that a whole month, possibly because to give us more time to raise and make more noise about it. It's actually supposed to be a whole year's thing, even though January is just dedicated to cervical cancer awareness. And it doesn't have, it's actually it causes the death, a lot of deaths. And so it is the commonest cancer death
in Ghana.
Whoa. You know, and then also because of the fact that it is a highly preventable cancer.
Yeah, yes. So the most...
most of the cancers, you're not sure. There are a lot of modifiable and non-modifiable factors that you're not sure, and they are caused by different factors that come together, and then they tell you that, okay, you have this particular cancer. But for cervical cancer, it causes deaths, the commonest cause of cancer deaths. But then it is also highly preventable.
Wow.
So that's the unique thing about cervical cancer.
Let me ask you this question. You say, and we'll come to what it is, the symptoms and all of it, later in the conversation. You say it's the most common cancer that leads to death in Ghana. My question is it, or which cancer then is the most lethal? Lethal in the sense that
every cancer is lethal.
Yeah, let me rephrase the question maybe a bit more appropriately. You talk about the fact that cervical cancer is the most common that leads to death, but also the most preventable.
Yes.
Right. So it means that if it's found early and all of that, you survive. My question, cancer is almost like a death sentence, or it's a death sentence then?
In fact, I would say that all cancers are death sentences when they present late.
Wow.
Very important. We need to put that in perspective. When they present late, it's very unlikely to be in the state that you can do any medical intervention to actually cure. So at those states at which you present, which is late or advanced stage, it means that there's little that the medical eye can do for you. You may just have to manage the symptoms, okay, as and when they come, until you end up leaving. You get it. But then the good thing about cervical cancer is that about 90% of it is associated with an infection that we know. You get it. As opposed to other cancers that you can't specifically say on record that 90% of it is associated with this particular virus that can easily be prevented. You get, so that's the unique thing about cervical cancer. 90% of it is associated with a particular
cancer
infection.
Okay.
A particular viral infection that can be prevented. And it just doesn't happen that you just wake up one day and then you have the cancer. No, it takes time. From the time that you get infected to the time that it becomes a full-blown cancer. It goes through stages. It goes through, so usually, I mean, when you get infected with the virus, HPV, two things can happen. Is either the body is able to clear it and it goes away, or it goes on to become a chronic infection. Now, this chronic infection, two things can happen there as well. Is either it regresses and the infection is cleared, or it moves to something we call precancerous lesions. And all these, we are talking about time. And then when it gets to the precancerous lesion, there's still hope. You can do a lot about it and then nip it in the bud. If it persists and you don't screen to be able to tell that, then it can move on and then now become the cancer proper. So there's a lot of time. And that is why we want people to be able to be comfortable to talk about their cervix. The cervix is hidden. It's not like the breast that is even out there.
Wow. So
cervix is hidden, and then it means that, and it's
Doc,
also
we'll take a break. You know, a lot of messages are coming. We'll take a break. We'll come back and delve into the conversation. You're still watching Sunday Breakfast right here on ChannelOne TV with me, Jude Duncan. The conversation is on cervical cancer awareness. We'll delve into the disease proper and all that there is to know about it. Don't go away. We'll be right back after this break.
It's time to reset yourself and everything else around you for success in the new year. Tune in to the Effective Living Series 2025 this January on ChannelOne TV and 97.3 City FM. Start your year with insightful discussions and expert tips on personal growth, health, success, and more. From the 6th of January, join Apioko and Caleb Kuda engage our guests with various expertise on the Effective Living Series for a comprehensive guide to resetting your life in 2025.
This is the Effective Living Series 2025
on ChannelOne TV and 97.3 City FM. My name is Caleb Kudas.
My name is Apioko Sarah Mashong Abe. Apioko will suffice.
Week 1 kicks off with Personal Reset. Week 2 focuses on resetting your personal economy. Week 3 is all about resetting your health. Week 4, resetting business, calibrate, remodel, and rebuild. Catch the Effective Living Series live on the City Breakfast Show on 97.3 City FM and Breakfast Daily on ChannelOne TV, Monday through Thursday. Don't miss out on transforming your life for the better every week only on ChannelOne TV and 97.3 City FM. The Effective Living Series 2025 is powered by ChannelOne TV and 97.3 City FM and is proudly sponsored by Hallmark Cafe. Hallmark Cafe, delight in every sip and bite.
Life is a celebration of moments. Big and small.
The sun is scorching, I'm feeling the heat.
With Piva Drink, every moment becomes a refreshing celebration. From the beach to your home, in every corner of your world. Piva Drink adds a burst of refreshment.
And orange. Give me Piva cocktail and tangerine.
Celebrate every moment with Piva Drink. Refreshment for every occasion. Piva Drink, a taste you will love.
P for Piva.
This advert is FDA approved.
Welcome back. This is Sunday Breakfast, and we are still here with Dr. Kalsum Adam helping us through a conversation on Cervical Cancer Awareness Month. And for me, it's like the stats around the conversation is even more intriguing for me than what the disease is actually, right?
Yeah.
So, Doc, let's just go back to the conversation. We're still talking around some numbers, and all of that. I don't know if it's a good time to now talk about what cervical cancer is. Unless maybe Eno has
No, I was just going to announce the WhatsApp numbers to our viewers. If you have any questions or concerns that you want Doc to address, send it to the WhatsApp number 0204-447-033. 0204-447-033. So yeah. What is cervical cancer? Okay, so before we even delve into what cervical cancer is, so I want to just quickly mention a few numbers.
Okay.
So worldwide statistics from 2018 shows that annually you get about 570,000 people being diagnosed of cervical cancer, and out of that you have about 311,000 losing their lives.
That's a high number.
Exactly. And that's why this conversation is very important.
Absolutely.
And when you look at local setting, you have somewhat about 3,000 annually, an estimate, about 3,157 people being diagnosed, and out of that you have about 2,119 ending up losing their lives. So this just tells you the high mortality rate associated with late diagnosis of disease, of a disease that is highly preventable, of a cancer that is highly prevalent, but you can actually prevent it if you do know what to do. So cervical cancer, again, I would say is cancer that is affecting the cervix. And we all know that the cervix is the little area that is the lowermost part of your womb, and it is that junction that connects the vagina to the uterus. Okay, so that little area that is hidden within, so you can't see the cervix usually. You would have to actually open up the vagina for you to be able to see that region. With usually you use a speculum, and that speculum would lift the vaginal walls that are usually together for you to be able to visualize the cervix. In the cervix, there are different parts of it. We have the outermost part, which is called the ectocervix, and then a little channel that goes in there, which is called the endocervix. Okay, so this region is quite small and tight, as we are talking, as we are just mentioning. And the thing is that because the cervix is usually the region where during sexual intercourse, that is where the thrusting goes to. So you can imagine the fact that if we are talking about HPV and its high risk or its high association with you developing cervical cancer, is in the sense that if you do have an infection that goes straight to the cervix, it can stay in the cervix. And then if it is not diagnosed early and the body is not able to clear it as usually as it does because of some challenge in immunity, even some challenges that have to do with that specific type of HPV that you have been infected with, then it means that it will stay for a very long time and then continue to cause destruction, and eventually when you may have signs and symptoms that is too late, it means that you have advanced disease. So in a nutshell, cervical cancer is when you have cancer of the cervix. You have the cells there are dividing, begin to divide in an uncontrollable fashion, and eventually they tend to move to other parts of the body. So they don't stay at where the cervix is, but they destroy the cervix and then they move to other parts of your body, other vital organs within your body and then cause a little more destruction, and eventually you end up with advanced disease. And 90% of cervical cancer, as we have it in literature, is associated with a particular infection, which is the HPV virus. So HPV means human papilloma virus. And globally, we have over 200 types of these HPVs. And out of this over 200, we have about 40 of them that are high risk. So when we say high risk, it means that if you get infected with that particular type of HPV, chances are that it can progress to you getting a cancer. Okay, so about 40 of them are high risk. And out of this 40, we have about 14 of them that are sexually transmitted. You get it? So 14 are sexually transmitted, and we have the commonest ones that I would want to mention here are, we have the 16, the type 16, and the type 18. They are the high risk ones. And these ones, 70% of cervical cancer is caused by type 16 or type 18.
Wow.
Now,
which one is more prevalent here? The types you just mentioned.
So it depends. I mean, once we have cervical cancer, we see the 16s, we see the 18s. There are times that there are other high risk ones too may end up causing the cervical, like the 31, 35, 45, there are a number of them.
If I may ask.
So it just has to do with you looking at it and able to identify that, okay, so let's number them because there are over 200 of them. You get it? So it's not like a particular numbering system. Okay. But once, let's say this HPV one, okay, this is the first time we have seen this type of DNA in HPV. So let's give it one, let's give it this. But then when you do the PCR typing, you tend to see particular ones that you have named or you have given a particular number. You tend to see them more associated with certain types of diseases. So like cervical cancer, we have seen that a number of people, when you take their cells and then you notice that a lot of them, it is the 18 and the 16 that they are coming with. So you can make inferences and associations that, okay, so for cervical cancer, 70% of them are caused by the high risk, which is the 18. Okay. Now, the others that have also been named are the 6 and the 11. So HPV 6 and 11 they are low risk. They've been associated with you getting genital warts. So people getting these growths which are not cancerous, but they are benign, either on the vulva or even on the penis or any other part of the reproductive organ. So those ones are the low risk ones. And 90% of these genital warts have been associated with the HPV 6 and the 11. Okay. So it's just for you who is at the lab to be able to identify the particular one. You're just giving them names so that you would be able to tell that, okay, so this particular one with this particular arrangement of DNA and all of that is the one that is associated with either you developing the cervical cancer or the genital warts. And sometimes even these high-risk ones have also been associated with other forms of cancers, like oropharyngeal cancers. Because of the change in sexual orientation now, people tend to do oral sex and all of that. So oropharyngeal cancers are also one of the cancers that these high-risk HPVs tend to predispose to. So cancer with the vulva, cancers associated with even the penile shaft and what have you. So once you have this high-risk HPV affecting these parts of the reproductive organ, chances are that these infections may persist than usual, and then eventually it would transform to precancerous lesion, and then full-blown cancer.
Doc, you've been mentioning HPV. What exactly is HPV?
So HPV, it's an abbreviation for human papillomavirus. Okay, so it's a DNA virus that causes changes. So if you have the infection or you're infected with this HPV, what it does, it ends up incorporating its DNA or causing changes within the cell, the DNA of cell, and then now the DNA of your cells will now start to replicate in an uncontrollable fashion, and then eventually you may end up with the cancer that we are talking about. So aside looking at whether we have high risk HPV or low risk HPV, there are a number of risk factors that will predispose us. It's not everybody who will just get up and then eventually end up with cancer. No, there are some risk factors that have been documented to be associated with developing cervical cancer. And these risk factors, we have you indulging in having multiple sexual partners. That's one of them. So it predisposes you to the HPV.
Which can also then lead to you getting cervical.
Exactly.
But we don't say that cervical cancer is a sexually transmitted disease.
So you would say that the HPV, which causes 90% of the cervical cancer,
is sexually transmitted. Well, but it's a stretch to say cervical cancer is sexually
transmitted. So you can infer, because of the high percentage of the cervical cancer being caused by HPV, you can infer more or less. So that's why we can confidently say that it is a preventable disease. Because if you can prevent you getting infected with the high-risk HPV, the likelihood is that, or chances are that, you may not develop cervical.
You need to just go back to the ABC of abstinence.
Exactly. If you can't be faithful and then use of barrier methods, which is the condom.
Those who have more than one partner, we beg.
Would it be safe to say
just
that
stick to one?
Men are the ones who give women HPV?
It's not safe.
Is it safe to say that?
It can be.
Why are you fighting for it? Let
Doc
answer my question. Are you the doctor now?
The question is flawed on arrival. So it is not safe. You should stick to one.
Is it safe to say that men?
It's also safe to say that women are the ones who are doing that thing.
Doing what thing?
So what I would say is that it's either ways.
Yeah.
Once you have the infection and the two of you are together, chances are that you can transmit to the female. The female can also transmit to
the sexual partners.
Has the infection.
Yeah.
She
multiple sexual partners.
So the males, what it means is that if the males are infected with the high risk HPV, they can end up being a reservoir to other people if they are not faithful. If their immunity is not able to clear the infection, they can also end up getting other forms of cancers because they don't have a cervix.
Yeah.
They can end up having penile cancers.
Prostate.
No, not prostate.
Now you're stretching it.
Get it. Penile cancers. You get it. Or if they get infected with the low risk ones, like the 6 and the 11, and the warts, the genital warts. So it's very important when possibly in our subsequent discussions we'll talk about the vaccines that are available. So you don't vaccinate just one sex, then both have to be vaccinated to protect them from getting the infection so that they can't transmit it and eventually end up getting these cancers that we are talking about. So having multiple sexual partners is a risk.
Exactly. The crack says stick to one. No, Charlie, you know what? The thing is you one can do. Charlie, you know what I'm talking about.
And then having
only one person can give you the thing. Charlie, stick to one. Doc, sorry, you were saying something.
Yeah, and then also having sex intercourse at an early age is also another risk factor. I would explain that. So from the beginning, we've been talking about you getting the infection, and the infection persisting over a period. So me is a very important for us. So let's take two individuals, patient A and patient B. Patient A started being sexually active at age 18, as opposed to somebody who started being sexually active at age 25. And these two patients may have had or been exposed to the HPV virus. Now, if you are looking at somebody who started at 18 as opposed to somebody who started at 25, and assuming that they both had equal risk of being exposed to the HPV, and they are not screening, it means that when each of them end up at age 35, chances are that the person who had the first exposure at 18 would develop the cancer early, as opposed to somebody who got the infection at 25. So early sexual intercourse is another risk factor, because it gives us more time to be exposed to the infection and then subsequently developing the disease. So having early sexual intercourse is also another, we call it early Koisake. And then other risk factors could be so anything that reduces your immunity would make the grounds fertile for this infection to persist and eventually become cancer. So we are talking about smoking. Smoking is everywhere when it comes to cancer. Okay, and then alcohol use is also another. So all of these are risk factors. And I would want to quickly add that having STIs also makes it conducive for the HPV to persist. So to have STIs like syphilis that is not treated, and then you have sperm-posed infection of HPV, chances are that you may develop cervical cancer or precancerous lesions earlier than somebody who doesn't have any STIs at all. And then HIV infection as well. So HIV infection is another risk factor for you to cervical cancer, as opposed to somebody who has who does not have the HIV. These are some of the risk factors that would predispose you to developing cervical cancer, as opposed to people who do not have these risk factors.
There are questions here. Mame from Koftown wants to find out if one can still bear children after being diagnosed with cervical cancer.
So it depends on the stage of the cervical cancer. If it's an early stage and you can be cured of it, yes. After a period of through possibly surgery and having gone through other adjuvant therapies like chemo and radiation, yes, you can eventually end up being fertile again. But that also depends on, once you are diagnosed, you have to go through thorough investigations to be able to your baseline. So there are times that you may have to harvest some of the ova or some of the eggs, and then you go through the treatment. After that, there are ways of you to get pregnant subsequently, because remember, if you are radiating, it also has its side effects on the ovaries, and then chemo also has some effects on all of these areas. So you need to be able to properly diagnose and then give a comprehensive plan for a particular patient, and then that's should help eventually.
That's if they recover from.
Yes.
How often should you be screened for cervical cancer?
So cervical cancer screening modalities are many, but there are a few of them that we can discuss. So we have the VIA, which is visual inspection with acetic acid, and then we have the pap smear, and then we also have the HPV DNA testing, which we usually would call the co-testing. So if you are doing a VIA or the pap smear and it's negative, it's advocated that you do that every 3 years. So once you have a negative test, the next time you would have to get another test would be in 3 years. But if you do the co-testing, which is you checking the cytology or the cells, the morphology of the cells, and then also going on to look for the HPV infection itself through PCR, then you can do that every 5 years. So it's something that once you do the test, you need to put it in your calendar and know the next time you are due. The reason for the 3 and the 5 years is because HPV infection, as we said, it takes time to move from one. It just doesn't happen like that, that you get the infection straight away. No. So we say that if you are of good health, it takes about 15 to 30 years from the first time of infection, if the infection doesn't clear, to get to full-blown cancer. But if you do have some immune compromised states, then that is when it will take you a shorter period, which is about 5 to 10 years, for you to be able to move from first stage of infection to the full-blown cancer. So it gives us time, really. It gives us a lot of time, 15 years, 30 years, for us to screen and be able to know our status and quickly do something about it before it becomes a late disease. And unfortunately, some of these signs and symptoms associated with cervical cancer, when you do have them, it means that the disease is advanced. And that is what we don't want people to get to. We want people to be able to screen for cervical cancer, to be able to screen for the HPV infection quite early, and diagnosis should be done very early, and treatment should be instituted before you end up with advanced disease that may push you to come to the hospital with signs and symptoms indicative of advanced disease.
Oh.
And then, so the screening modalities, as you have mentioned, either 3 years or 5 years. But also, it can be prescribed to you as an individual based on what is seen. So it's likely that if you do have a positive finding, it may be shorter than the 3 years or the 5 years, depending on what is found. So that you can be, it's a monitoring tool as well, so that if we find precancerous lesions and these precancerous lesions are taken away for histopathological examination, we give you a shorter period to be sure that really the cancer has been stopped or the progression of the infection has been really taken care of. So it depends on the individual, but if you are healthy, then it takes about 3 years to 5 years. 3 years pap smear, VIA, and then for the co-testing about 5 years. So depending on which one we want to.
And is there a particular age that you need to start, or?
Yes, so once you are sexually active. But we assume that by age 25, you should start screening once you are sexually active. You should start having your pap smear, your first pap smear, and then you maintain subsequently with either your 3-year schedule or your 5-year schedule. And there are vaccines also available that could be given, especially to the young ones. So if you are female, 11 to 12, if you are female, 10 to about 12, male 11, 12, you can have these vaccines that will prevent you or protect you against the HPV specific subtypes. But mind you, you getting the vaccine doesn't make you immune to not getting the HPV infection. You remember from beginning I mentioned that there are a number of subtypes of these HPV, and 40 of them are high risk. But the commonest ones that we mentioned was the 16 and the 18. The vaccines, most of the vaccines now would protect you against the 16 and the 18, but it doesn't protect you from the other high risk ones. So if you do get this protection from the vaccination, it reduces your chances, because 70% of it is caused by the 16 and 18. But how about the 30%? So you still need to be committed to your screening schedules so that you can find anything that is happening if it says you get infected with the other high risk HPVs, and then we can do something about it. And actually, WHO has a strategy to eliminate cervical cancer by 2030.
Okay.
And the strategy is the 90-70-90 strategy, where it has tasked almost everybody worldwide to try and have about 90% of girls, who are about, by age 15, they should have been vaccinated with the vaccine. And then 70% of ladies should have been screened with a very high performance screening tool by age 35, if latest at all by 45. And then 90% of those who have been diagnosed should have undergone treatment, okay, by year 2030. This is a strategy that they have challenged all countries all over the world to help try and eliminate cervical cancer. It is actually very doable if we go out there and then make sure that we are vaccinating our girls, we are screening as ladies, and then if you are screened, that means that once we are screening well, it means that we'll be able to catch the disease very early. And if we catch it early, chances of survival is also high. So if we are able to go by this 90-70-90 strategy, I'm sure cervical cancer would have a story to tell by 2030.
Dr. Adam, thank you so much. So for all the ladies, listening and watching us, do get screened. I know a few people who I have tried to pull with me to get screened, and they have blatantly refused. Hopefully I can change their minds this year, 2025. You go with us?
No, also stick to one partner.
Yeah, definitely. That's very important. Stick to one partner.
Definitely.
Mr. Hansen is joining us after this break. You do not want to miss that conversation.